It's very important telemedicine for rural states as Arkansas. Many rural communities don't have any access to a neurologist and even less to a vascular neurologist, and especially in Arkansas where the incidence of stroke is so high, it is highly important to have access to this type of expertise. The way telemedicine helps is providing access to a vascular neurologist with expertise in administering safely this medication. By video and audio interaction with the patient, we can see and examine a patient immediately through this live communication, and it is making the assessment more reliable, and it's making the administration of this medication safer. And otherwise, in our state, very small hospitals would have not given TPA to many patients. We really need access to vascular neurologists, and it is very important that access to this type of services is done in a very quick fashion. We are striving to get a driving time from every point in the population to a center where he can receive TPA of less than 30 minutes in the whole state, and we're currently covering 60% of the population in Arkansas within that range approximately. Our driving distance within 60 minutes is covering more than 90% currently, and that is a huge accomplishment of our program so far. Stroke is a brain attack that's more clearly understood for people. It is an event that happens suddenly when the blood supply to the brain gets cut off abruptly. That is, when an artery that brings oxygen and glucose to the brain gets suddenly occluded by a clot for the majority of the cases. And what this does is interrupts the flow of nutrients, and that area of the brain eventually dies. The treatment for an acute ischemic stroke is essentially administering through an IV line a very potent medication which is called TPA. What it does, it dissolves the clot that is occluding the artery and restores flow, and it's very important to do it very quickly after the onset of the symptoms, because the longer we take to restore flow, the more brain damage had occurred already. Telemedicine in Arkansas has made a huge impact so far. We have given TPA, which is a clot-busting medication, to more than 225 patients in the last 3 years, approximately, since the life of the program. And otherwise these patients would have never received this medication, and it's potentially life-saving as well as disability preventing, and that is the most important thing. Patients that do not receive this medication have much lower chances of recovering, and they have higher chance of dying as well. I am Nicolas Bianchi. I'm a physician. I'm assistant professor of neurology at UAMS.